Hi, my name is Alexia Ziegler. Today is November 23rd, 2017. The purpose of my video is to educate nurses about the pathophysiological mechanisms and alterations. While most people assume that nurses know everything in the medical field, the truth is some of them understand other terms, and as their career advances, they learn new vocabulary and a better knowledge base. For instance, pathophysiological procedures deal with pathology and physiology, including the absorption of biological nutrients. Nurses should understand the cause of various disturbances within the bowel, coupled with required interventions if the patient complains of abdominal pain, and the nurse or provider needs to find out what is wrong, whether it's acute or chronic, in other words, serious or non-serious. The intended audience that should watch this includes nurses in a facility, nursing students, other nursing staff that deals with patients that can help nurses kind of figure out what's going on, and whose levels of interactions with patients is high. Hence, the nurses should understand pathophysiological mechanisms and alterations, among other complicated features of the healthcare provisions. In the absence of physicians during an emergency, a nurse should be able to hone in on those skills and be capable of handling complicated aspects of digestion or any other physical assessment that needs to be handled. The issues discussed in pathophysiological mechanisms and alterations include bodily secretions, digestion, motor activities, and absorptions. Most of which is understood by the nurse. But again, if you're a new nurse, you might not know all these, and as you advance in your career, you'll learn more. The possibility of acquiring malabsorption syndrome is high in an acute care situation, as patients always come in and may have poor living conditions. So you will see kind of failure to thrive and other problems that may happen with malabsorptions. This means that the nurse has to comprehend everything about the field, including technical subjects. Learning objections to ensure the nurse understands all details, pathophysiological mechanisms and alterations, to determine the nurse's intellectual ability to the assessment of health conditions that affect the bowel, to establish a platform through which consultations and training can assist nurses to provide necessary forms of treatment of that patient. Evidence-based practice scenario that we can use in justifying some components of for this video involves a 59-year-old man, Caucasian, who drinks beer and smokes. An outstanding feature in this case is that he has a good indulgence for some behaviors that increase the likelihood of acquiring a gastric problem. In this case study, the man suffers from osteoarthritis, but he is on a medication. And in the area of EMR, your electronic health records, it's now become effortlessly to kind of find out what is really going on with that patient. You can look back into previous charts and sometimes find something, or if they come from another facility, within the same region, sometimes they are kind of linked together, so you can kind of see what they've been treated for, the medications, and other scans that have been used. Including the patient's medical history is very important. Technical terms including gastroesophageal emerged in this case. The nurse should ensure that they not only know these words, but also interpret statements in a way that an ordinary person can easily understand, talking to them, doing a good physical history on different types of medications that they use, signs and symptoms of how they're feeling, things that they have seen, either emesis, stool, anything along that line. The pathophysical mechanics and alterations might sound overly complicated, but interpretations would probably perplex somebody who does not understand this stuff. So anybody who understands the concept of bowel problems such as bleeding, abdominal pain would need a physical examination to determine that cause of pain. The idea incorporates pathophysiology and pathology, which means that the possibility of operating on an individual increases with the pathophysiology. So depending on the type of symptoms that this person has, they may end up going for surgery, and that would be a good reason to get a good history and kind of look through the medical charts if you can, if they're on that EMR, and consult that physician. Signs and symptoms it would be impossible to treat pancreatitis or gastroesophageal without an understanding of the condition, without sharing knowledge concerning the human anatomy. Nurses have an opportunity to learn about pathophysiologic mechanisms and alterations. They should associate various symptoms with gastric problems. For instance, talk about the relationship between peptic ulcer disease and upper gastrial endoscopy, which is a valid diagnostic tool. Arguably, pathophysiology opens one's intellectual capabilities beyond the things that people can ordinarily see. Without knowledge, nurses should know how to use or conduct pathological procedures to determine the occurrence of bleeding during an upper GI bleed or gastrointestinal problems. Signs and symptoms that you may see in your patient would be nausea or recurring upset stomach, abdominal pain, vomiting, indigestion, burning or gnawing feeling in the stomach between meals or at night, hiccups, loss of appetite, vomiting blood, coffee ground-like material, black tarry stools, weight loss, weight gain, depending on where the ulcer could be. How it is diagnosed, you will do an extensive physical history, medications, an assessment. We'll talk to the doctor and provider, go through other tests, which could include an endoscopy, where they put a thin tube containing a tiny camera inserted through the mouth. They'll check for inflammation, may perform a biopsy, and then if they perform that biopsy, they'll send it out to lab for an analysis. Blood tests, RBCs determine whether you're anemic. If they can also screen for H. pylori, which is an infection. It's a gram-negative infection. Percutaneous anemia with blood tests, or also a fecal occult blood. It's a stool test, and it checks for the presence of blood in your stool for a possible sign of gastritis. Treatment for gastritis usually includes antacids, proton pump inhibitors, or H2 blockers to reduce that stomach acid, avoiding hot and spicy foods. They will also, for H. pylori infection, your doctor can prescribe a regimen of antibiotics plus anti-blocking drugs such as Tums, Nexium. If gastritis is the cause of the percutaneous anemia, usually you'll get B12 injections. And then eliminating irritating food from your diet, such as lactose from in the form of dairy or gluten, can kind of help with that. In conclusion, human health remains pivotal to the nursing practice, but no one can achieve anything without establishing the anatomy of the body. Most technical activities are left with surgeons and physicians to kind of determine what's going on and how to take care of the gastro problems. It would be essential to create an opportunity for different people, including the nurses, to understand technical issues in healthcare to assist for the delivery of a quality medication. In essence, a training program facilitates the best mode to make sure that we can provide relevant levels of support to patients and families. Thank you.